throat lump, what you need to know. A lump in the throat can cause symptoms such as difficulty swallowing or hoarseness. Carry on watching our video. There are many other reasons why it may occur. The main cause of a lump in the throat is swollen lymph nodes. In this video, we will explain to you what you need to know about a sore throat. The main causes of a lump in the throat. As mentioned, the most common cause of a lump in the throat is swollen lymph nodes. This can happen for a number of reasons. An infection nearby, for example a cold or a laryngeal infection. This is very common, especially in children. Mononucleosis, dental abscesses, and tonsillitis also affect. An infection of the lymph nodes is also called lymphadenitis. Systemic diseases such as HIV and tuberculosis. Some disorders of the immune system can cause a lump in the throat. Similarly, certain medications can cause the lymph nodes to swell. A lump in the throat can also be caused by a bladder, i.e. a sac full of fluid. Cysts are easily recognizable as many of them occur at birth. Another possibility is a problem with the salivary glands. However, we cannot overlook the fact that it may be due to cancer. Remember that malignancies are more common in the elderly. Although it may be a cancerous lymph node, it may be a tumor in a neighboring structure that has spread. It may even be a metastasis from a more distant tumor. Worrying signs and symptoms if you have a lump in your throat. You should see a doctor for a checkup. A soft, painful lump is usually a sign of infection. These lumps tend to disappear after a while. However, lymphadenitis causes tenderness in the lymph nodes. If the lump is hard, does not move, and does not hurt, it may be a tumor. Diagnostic examinations. Many tests can lead to diagnosis. However, if the patient is young, there is usually no fear of a tumor. Also, these tests are usually not necessary if there are signs of nearby infections. Likewise, doctors will evaluate the texture and whether it causes pain. You may also be asked for a chest x-ray. Biopsy is an examination in which a portion of a tumor is removed. In addition, doctors may order CT and MRI scans. Sometimes ultrasound can also help. Conclusion: a lump in the throat is usually caused by a lymph node that has increased in size. The most common cause is a nearby infection that usually goes away on its own, but you should pay attention to other symptoms. If the lump in your throat does not hurt and does not move, it may be a tumor. Ideally, you should see a doctor to be diagnosed.